Silence, the deadliest epidemic of our time. Welcome to a conversation that will challenge everything you thought you knew about health, community, and the power of awareness. Today, we're diving deep into insights gleaned from an extraordinary individual who's revolutionizing how we approach community health. Toria, a beacon of hope in Detroit, is not just changing lives, she's saving them, one conversation at a time. Imagine a world where silence kills more people than any disease. A world where lack of awareness claims more lives than the most aggressive viruses. This isn't some dystopian fiction. This is our reality. And nowhere is this more evident than in the heart of Detroit, where a silent epidemic is ravaging the black community, particularly black women. Let this sink in. Black women in Detroit account for 50% of HIV cases. Half of all HIV cases in a major American city concentrated in one demographic. This isn't just a health crisis, it's a societal failure of epic proportions. Why is this happening? The easy answers, lack of health care access, poverty, personal choices, barely scratch the surface. The real culprit, as Toria has compellingly argued, is far more insidious and yet, paradoxically, easier to combat. It's awareness, or rather the profound lack of it. We're not talking about a simple absence of information. We're talking about a chasm between knowledge and action, a disconnect so vast it's swallowing lives whole. This disconnect is at the heart of our failure to address not just HIV, but a whole host of health and social issues plaguing our communities. Toria stands at the forefront of bridging this gap. As a community health worker, a doula, and a women's leader at her church, she's not just a healthcare provider, she's a bridge builder, connecting disparate parts of the community and weaving a network of awareness that has the power to save lives. But let's pause for a moment. In our information-saturated age, how can lack of awareness still be such a deadly issue? Isn't everything just a Google search away? This assumption isn't just wrong, it's dangerous. True awareness isn't about having information at your fingertips. It's about understanding its relevance to your life. It's about internalizing knowledge in a way that fundamentally changes your behavior. And this is where our current approaches to health education and community outreach are falling catastrophically short. Think about it. We've been running HIV awareness campaigns for decades. We've plastered cities with posters, distributed millions of pamphlets, and spent countless hours on educational programs. And yet, in Detroit, we're facing an HIV crisis of staggering proportions. Clearly, something isn't working. What Toria understands, and what we need to grasp, is that awareness isn't a one-size-fits-all concept. It needs to be tailored, personalized, and deeply rooted in the community it serves. It needs to speak not just to people's minds, but to their hearts and souls. This is where Toria's multifaceted approach comes into play. As a community health worker, she brings medical knowledge directly to the people who need it most. But she doesn't stop there. As a doula, she connects with women at one of the most vulnerable and transformative moments of their lives, using this connection to build trust and impart crucial health information. And as a women's leader in her church, she taps into the spiritual dimension of health and well-being. This is crucial because for many in the black community, the church is not just a place of worship. It's a cornerstone of social life and a trusted source of guidance. By weaving together these different threads, medical knowledge, personal connection, and spiritual guidance, Toria creates a tapestry of awareness that is far more effective than any traditional public health campaign. But here's the truly revolutionary aspect of her approach. It's not just about disseminating information. It's about empowering people to become advocates for their own health and the health of their community. When was the last time a public health message truly moved you to action? When was the last time a statistic about disease rates made you change your behavior? For most of us, the answer is probably never. That's because facts and figures, no matter how alarming, often fail to connect with us on a personal level. What does connect with us? Stories, relationships, a sense of community and shared purpose. This is the secret sauce in Toria approach. She's not just telling people about HIV, she's showing them how it affects their lives, their families, their futures. She's not just handing out condoms. She's building a community of informed, empowered individuals who can make healthier choices and influence others to to do the same. Let me share a story that illustrates the power of this approach. Maria, a young woman in Detroit, had always considered herself well informed about sexual health. She'd seen the posters, heard the PSAs, even attended a few workshops at her community center. But it wasn't until she became pregnant and met Toria as her doula that the information truly hit home. During their sessions, Toria didn't just talk about pregnancy and childbirth. She created a safe space for Maria to ask questions about all aspects of her health, including HIV. For the first time, Maria felt truly heard and understood. She wasn't just receiving information. She was engaging in a dialogue that addressed her specific concerns and life circumstances. This personalized approach led Maria to get tested for HIV for the first time. She also started talking to her friends about the importance of regular testing and safe sex practices. One conversation had sparked a chain reaction of awareness and action. This approach has implications far beyond HIV prevention. It's a model for addressing any number of health and social issues. Imagine applying this kind of community-centered, relationship-based awareness building to issues like diabetes, heart disease, or mental health. The potential for positive change is enormous. But let's be clear, this isn't easy work. It requires time, dedication, and a deep understanding of the community you're serving. It requires breaking down barriers of mistrust that have been built up over generations. It requires being willing to meet people where they are, not where we think they should be. Toria Taggart's work also challenges us to rethink our assumptions about health education and community outreach. Too often, we approach these issues from a top-down perspective, and we assume that if we just give people the right information, they'll make the right choices. But human behavior is far more complex than that. What Toria understands is that health decisions are not made in a vacuum. They're influenced by a complex web of factors, cultural norms, personal experiences, economic realities, and spiritual beliefs. By addressing all of these factors simultaneously, she's able to create a more holistic and effective approach to health awareness. This approach also challenges our assumptions about who should be delivering health information. Traditionally, we've relied on doctors, nurses, and other healthcare professionals to be the primary sources of health education. But what if the most effective health educators are actually members of the community itself? Toria Taggart's work suggests that this might indeed be the case. By training community members to be health advocates, we can create a network of trusted voices that can reach people in ways that traditional healthcare providers often can't. Consider the story of James, a barber in Detroit. After attending one of Toria's community workshops, he realized the unique position he was in to spread awareness. Every day, he had conversations with dozens of men in his chair. Why not use that time to talk about health? With Toria's guidance, James started incorporating health discussions into his barbershop chats. He didn't preach or lecture. Instead, he shared information naturally as part of the everyday conversation. The result? Several of his clients got tested for HIV for the first time. Some started asking questions about other health issues. The barbershop became a hub of health awareness, all because one person decided to start the conversation. But here's the really exciting part. This approach doesn't just improve health outcomes. It has the potential to transform entire communities. When people become advocates for their own health and the health of their neighbors, it creates a ripple effect. It builds social connections, fosters a sense of shared purpose, and empowers people to take control of other aspects of their lives. Imagine a Detroit where every church, every community center, every barbershop and beauty salon becomes a hub of health awareness. Imagine a city where conversations about HIV prevention are as common as discussions about the weather. Imagine a community where young women feel empowered to make informed decisions about their sexual health, and where young men see it as their responsibility to be part of the solution. This is the vision that Toria Taggart is working towards, and it's a vision that has the potential to revolutionize not just how we approach HIV prevention, but how we think about community health as a whole. But let's be clear, this isn't just about Detroit. The lessons from Toria Taggart's work can be applied anywhere to any community facing health challenges. Whether it's rural America grappling with the opioid crisis or urban centers dealing with rising rates of chronic disease, the principles remain the same. Build awareness through relationships, empower community members to be health advocates, and address health issues in their full social and cultural context. Now, I can almost hear some of you thinking, this all sounds great, but is it really practical? Can we really expect every community to have someone like Latoria Tagger? The answer is we don't need every community to have a Latoria Tagger. What we need is for every community to embrace the principles that guide her work. We need to shift our focus from top down health education to community driven health empowerment. We need to invest in training community members to be health advocates. We need to recognize that health is not just a medical issue, but a social, cultural, and spiritual one as well. This shift won't be easy. It will require rethinking how we allocate healthcare resources. It will require breaking down silos between different sectors of society: healthcare, education, religion, social services. It will require a willingness to listen to and learn from communities rather than just prescribing solutions. But the potential rewards are enormous. Imagine the lives that could be saved, the suffering that could be prevented, the communities that could be transformed. Imagine a world where health awareness is not just a campaign slogan, but a lived reality for every individual and every community. This is the world that Latoria Tagger is working to create. And it's a world that we can all help build, one conversation, one relationship, one community at a time. So, as we conclude this journey through the insights and innovations of Latoria Tagger, I want to leave you with a challenge. Look around your community. Where are the gaps in health awareness? Who are the trusted voices that could become powerful health advocates? How can you contribute to building a culture of health empowerment? Remember, awareness isn't just about knowing, it's about doing. It's about taking the knowledge we have and turning it into action that can change lives and transform communities. Ask yourself, what conversation am I not having? What truth am I silent about? What action am I postponing? Your silence could be contributing to the deadliest epidemic of our time, the epidemic of inaction. Today, right now, you have the power to break that silence. You have the power to start a conversation that could save a life. You have the power to be the Latoria Tagger of your community. Will you use that power? Will you be the voice that breaks the silence? Will you be the catalyst for change in your community? The choice is yours. But remember, in the face of this silent epidemic, neutrality is not an option. Inaction is not harmless. Your silence could be deadly. So speak up, start the conversation, be the change. Because in the end, true health awareness isn't just about preventing disease. It's about creating a world where every individual, every family, and every community has the knowledge, the resources, and the power to thrive. The journey starts now. The revolution begins with you. Are you ready to break the silence?